During my childhood, I was once traveling with my parents. We came across an accident. Two cars had hit each other. The driver was thrown into a ditch through the window. My father, being a doctor, ran to the driver to resuscitate him. I was a very young child at the time. I could not assess what exactly was going on. What I could see was a man dying, a man in pain. This man was surrounded with blood, with splinters, with bones and fragments, which I did not want to see. There was a lot of blood all around that patient. That man was undergoing hemorrhage. That was bleeding. Today we are going to talk about that bleeding that is always there in a traumatic patient. The lecture has been divided into four sections. In the first section, we'll be talking about the pathophysiology of bleeding. We'll see what are the various factors that contribute to bleeding, what are the various pathways that actually are affected by the bleeding, and how does the body respond to the bleeding. In the second section, we'll talk about various definitions and perimeters of hemorrhage. We'll see what the different types of hemorrhage are. We'll see why the types are important, and we'll talk about the management of these types. In the third section, we'll deal with the degree and classification of hemorrhage. We'll classify hemorrhage based upon the percentage of blood loss. We'll see the management of hemorrhage based upon this classification, and we'll talk about the treatment of the hemorrhage once it occurs in a patient. In the last section, we'll talk about the management of this patient. The management of patient with bleeding, with hemorrhage. We'll identify the source of bleeding, and we'll talk about the resuscitative attempts. Then we'll talk about hemorrhage control and damage control resuscitation. I hope you're excited about today's lecture. For further such lectures, keep watching sqadia.com.